So we are continue to report these remarkable response rates of 80% of complete response rates in these heavily pretreated chemotherapy refractory patient population using CD19 targeted CAR T cells, regardless of disease burden. These T cells actually work well whether you have a high disease burden or the low disease burden. But what we'll be highlighting in this talk will be the side effects do differ. So even though the response rates are the same, the more disease you have, more likely you're going to experience a toxicity. If you have less disease, it works in the same degree, but the patients do experience less toxicities too. The long-term outcome we're also going to report as well. The patients with the less disease also tend to do better, although their difference in survival is not statistically significant. The third finding that we are going to report, that we're going to highlight during this abstract session, the presentation, is the role of bone marrow transplant after receiving CAR T cells, which is in a way the controversial topic. We can't really say definitively because the number of patients treated is relatively small to really come out with a very definitive conclusion. However, what we have observed is that whether you have a high disease burden, low disease burden, after getting the CAR T cells, if you have achieved a good remission, meaning MRD negative complete remission or deep remission, that there doesn't appear to be no apparent benefit of the transplant in this patient population. So the role of transplant after CAR T cells continues to remain unclear, and our data actually shows that there may not be a benefit because of some of this patient toxicity they get after transplant, and then the relapses do happen after transplant too.